In August and again last week, President Trump promised to declare a state of national emergency over the opioid crisis. But here's what he said today.
Effective today, my administration is officially declaring the opioid crisis a national public health emergency under federal law.
Now, they sound similar, but there's a big difference between the two. So what is a public health emergency? Well, our Verifier team looked into that. They found that they're primarily used for short-term emergencies. It mostly frees up money and creates more flexibility for rounding up federal, state, and private resources. In this case, it shifts grants to help people get treatment, opens up an option for telemedicine to help people in rural areas. It lets states and the feds hire substance abuse specialists and frees up Labor Department grant money for people out of a job because of addiction so that they can get treatment. And finally, it taps into the Public Health Emergency Fund. Doctors tell us that they're seeing opioid cases in hospitals unlike anything they've ever seen. News 8's Monica Hernandez tells us about the patients showing up at hospitals just a step away from death.
On paper, Mike Munzel had everything going for him. A high school athlete who started college for engineering until his drug addiction got in the way. Eventually, he started shooting heroin.
I started breaking into cars, stealing from my parents, stealing from everybody. Like if it wasn't bolted down, like I was taking it.
Anything to fuel his addiction, until one night.
I got arrested for stealing a pack of cigarettes. I searched in my car and just found loads of stolen stuff.
4 days later, he ended up in rehab at Greenhouse Treatment Center in Grand Prairie.
Being here in a safe place, in a controlled environment, it really did save my life.
An alarming number of people aren't so lucky. Thousands of Texans are dying every year from opioid addiction or ending up in emergency rooms like Dr. Glenn Hardesty's at Texas Health Resources.
They're basically not breathing. They're very flaccid. They're just like a wet rag.
Doctors say the one thing that can reverse the effects of an overdose is this. It's known as Narcan, and it's becoming more and more widely available. In fact, Walgreens just announced it would stock all of its stores with it. Hardesty says a public health emergency should have been declared a long time ago, but he's glad it happened today.
If this casts more of a light on the situation, I'm ecstatic about it.
As for Mike, he's now working at the treatment center where he once got sober, helping others do the same.
If you discovered the cure for cancer, like, could you keep that to yourself? Like, probably not, right?
Monica Hernandez, Channel 8 News.